We've had you on the show many times to talk about health care and the Affordable Care Act and new news about the Affordable Care Act as it affects Wisconsin. We're paying a lot more for these insurance policies and for out-of-pocket costs than they are in Minnesota.
Yeah, we've been studying this for a while, and the gap is actually getting greater. Minnesota is a fairly similar state to Wisconsin, similar demographics, similar underlying medical costs, but the health insurance is 47% more expensive. That's our most recent report in 2016 than it is in Wisconsin, and that includes not just premiums. We looked at deductibles as well, and people are really suffering from deductible increases. In Wisconsin, deductibles went up 46% this year overall, whereas in Minnesota they were relatively stable because they actually had a state policy to try to keep deductibles lower. So in a Wausau, you're paying over $5,000 more than the state average in Minnesota. In Wisconsin, in Madison, it's only about $730 more.
What's the reason?
Which is still a nice, big amount, but not nearly as big. There's huge variations between areas which aren't fully explainable. So it's the wild, wild west. The difference is that Minnesota has been a really good job of trying to build on the Affordable Care Act, not fight over it, but figure out what a state can do to lower costs, increase value, whereas Wisconsin lawmakers, Governor Walker, have been focused on simply trying to undermine the health care law, and they don't have any health care policy other than that.
Well, we know that Wisconsin didn't take the Medicaid expansion and that Minnesota did. What are some other things that Minnesota's done? I know we basically haven't done anything to foster it. What has Minnesota done?
So taking the money for Badger Care, which we didn't do, they did for their state Medicaid program, that leads to cost shifting because more uninsured people go to the emergency room, the hospitals, and then they end up, if they can't pay their bill, it gets shifted onto private insurance. Also makes people sicker who are in private insurance, which also raises rates. But there's a rate review process in Minnesota where they look at the rates, the insurance rate filings, and decide whether they're reasonable or not and make them rebid and lower them if they're not justified. Wisconsin's been very lax. In fact, Governor Walker's insurance commissioner has not found one rate increase to be excessive. There's a good bill by Senator Larson and Representative Kolstey to address that and have rate review in Wisconsin, like we do with utilities already, but that's not even at a hearing as of yet. Also selling these lemon plans, the Affordable Care Act allowed states to continue to allow substandard plans to be sold, and Wisconsin did that. Minnesota did not. The result is people who could get insurance before the Affordable Care Act, people who are healthier, didn't have pre-existing conditions, kept cheaper policies that are full of holes. They're not very good policies, but what that does is not only make them vulnerable if they have a medical emergency or an unexpected illness because of the bills, but it also keeps healthier people out of the insurance pool, so it raises insurance rates for everyone else. So
how does it keep healthier people out?
Well, because healthier people are the ones who could buy insurance before we ended discrimination against people with pre-existing conditions. So if you grandfather in the substandard plans, it keeps the healthier people out of the insurance everyone else has to buy. And so it has a reverse incentive. It raises rates on everyone else, plus it leaves people with substandard policies, so if they ever need them, they're going to have a very rude surprise as far as what's actually covered.
But the argument there is a lot of these people have said, look, I don't need anything but emergency care. I want to make sure I'm covered but I'm healthy enough that if I want to pay less, I don't want to have to be mandated on what I can buy. I mean, that's kind of a crucial argument.
Right. Well, the problem is you don't know what you need until you don't know what disease you're going to get. You don't know what injury you're going to get.
Isn't that a personal choice to make? And shouldn't you have that right to make it?
Well, if we need to get everyone into the same insurance pool and spread risk. That's what lowers costs, so that healthy people are paying in to cover the smaller number of people who have more conditions. Then we need a system that actually rewards preventive care, chronic disease management, so that we keep costs down and have less specialty care, less emergency room care. We're not doing any of those things. We don't have a cost. The costs are not being discussed in Madison when they are the biggest issue out there. You go out there, people are really concerned about healthcare costs. States that are moving beyond the healthcare debate over the Affordable Care Act and trying to work on costs, like Minnesota, are keeping costs lower. States like Wisconsin that aren't, costs are going up. We're the fourth most expensive health insurance cost for individual health insurance in the country, which is a real problem, both for individual consumers, for access to healthcare, and for business competition, and for us being a competitive state economically. Healthcare costs are such an issue that we all need to pull together and work on it, right? They had the advantage of, because they have their own marketplace, they can try to bring costs down more. They can do various things to try to negotiate rates down, what's called active purchasing. Some of the things they've done with rate review have been enabled by that. But quite frankly, we can look at what happened in Minnesota and try to get the best of both worlds. We could use healthcare.gov, the national website, but have our own regulated marketplace and bring in improvements that increase value and lower costs. So You're
not saying you have to have a state exchange, just be able to put some modifications in to make sure it's run well.
You could have one where you do the regulation, but the federal government runs all the IT. So you get
Right,
out of the
right.
problems of having to set up your own system. So you could have the best of both worlds. So none of this is a reason not to work on cost and value. We have the most expensive healthcare system in the world by double, and a third of medical spending in the U.S. is not value added. So the next big thing, once we get everyone covered, we're not quite there, right, is to work on cost, because the system, it's not there's a problem with Medicare, for example. That's a great system. It's there's a problem with healthcare costs that we're not addressing.